Hi everyone, Jonathan Chan here again with a video discussing the diseases that I talked about in my previous video, the song on autosomal dominant and X-linked recessive diseases. Today is actually the day before the board exam, and I thought the best way for me to review would be to implement what I believe is the most effective learning strategy known to man. And this is the Feynman technique. Essentially, the Feynman technique is a way to check if you really understood the topic, if you really remember a topic, if you could explain it well. And so, that's what I'm going to try to do here. This is just the diseases that I talked about in my previous video. I think I'm gonna split this into two. You can probably watch this at 1.5 speed because I know I do that all the time with all the videos and the review classes that I take. But the point here is uh, what you should do ideally is when you're watching this video, you're going to integrate what you know. It's in spoiler here, so you can also say your answer while you're reading this, and also this is just gonna be one take. This is not going to be edited. This is the day before the exam. I'm just going to like explain all of the diseases that I know of that was presented in my previous video. So without further ado, let's get into it. Alport syndrome. Alport syndrome is a defect in type 4 collagen. Way to remember this would be 4 on the floor, type 4 on the floor. Other collagens would be type 1 collagen, which is found in bone. So, bone 1, that's type 1. Type 2 collagen would be cartilage. So, cartilage. Type 3 collagen would be retriculin. So, it would be found in your reticulin fibers. And type 4 collagen, 4 on the floor. What are the buzzwords associated with Alport syndrome? So the buzzwords associated with Alport syndrome. So again, a lot of these pearls are from the first aid for the USMLE. This has been my go-to book ever since like second year med school because it really has all of the high yield concepts and mnemonics that are relevant for exams. Okay, so what's the buzzword for Alport syndrome? This would be can't see, can't pee, can't hear B. Let's look further into this mnemonic. So why can't they see? Because these patients would present with retinopathy and anterior lenticonus. So these people with Alport syndrome can't see, and they can't pee because they would present with glomerulonephritis. The glomerulonephritis, HOHA. Okay, we're going to be talking about that later, but that's a way to remember the manifestations of patients presenting with nephritis. Why can't they hear B? Because these patients would present with sensory neural deafness. Okay? So, type 4 collagen is affected in Alport syndrome. What is a disease where you would have an antibody targeting type 4 collagen? This would be in Goodpasture syndrome. And Goodpasture syndrome is a type 2 hypersensitivity reaction. Just review the different hypersensitivity reactions. It's easily found in the net. Just do a Google search on it. So next, let's discuss the mnemonic to differentiate nephritic versus nephrotic syndrome. So so in a nephritic syndrome, recall our mnemonic HOHA. So this is hypertension, oliguria, hematuria, and azotemia. In contrast, for your nephrotic syndrome, you have pale. So you have proteinuria, albumin is low because you're going to be excreting it out. You have hyperlipidemia, and you would also present with edema. Next disease on our list would be Fragile X. So Fragile X have fragile eggs because they can't reproduce. And this is actually a trinucleotide repeat expansion disorder of, okay, so what is the trinucleotide repeated? It would be CGG. And we can use that as a mnemonic to remember its clinical manifestation, which is shin protrusion and giant gonads. So Fragile X would have giant gonads as well. Self-mutilation is common in Fragile X syndrome. And this can be confused with a classic disease that presents with self-mutilation as well. What is this? This is Lesch-Nyhan syndrome. And recall that we're going to be talking about Lesch-Nyhan syndrome in like the next video, I think, when we talked about uh, the other different diseases. But park that for a while. Self-mutilation can be found in patients with Lesch-Nyhan. And Fragile X is the most common what? Fragile X is the most common inherited cause of intellectual disability. Down syndrome is the most common cause of intellectual disability. However, we know that Down syndrome is sporadic. It's usually sporadic, and therefore it's not the most common inherited cause of intellectual disability. Now, to add to our plethora of diseases, there's another X-linked dominant disease which I actually found in the first aid when I was reviewing it again this this morning. This would be hypophosphatemic rickets, previously known as vitamin D resistant rickets. It's a disorder in which bones become painfully soft and they bend easily, which causes phosphate wasting because there's deficiency in the, or a defect rather, in the proximal tubule causing phosphate wasting. So with that, I think we need a new mnemonic for our X-linked dominant diseases. And what would our new mnemonic be? So for X-linked dominant diseases, X-linked dominant are DAX. Okay, so they're DAX. X-linked dominant are DAX. Vitamin D resistant rickets, Alport syndrome, and Fragile X. Okay, so we're going to move on now to the autosomal dominant diseases that we talked about earlier. Von Willebrand disease. So von Willebrand disease is a hereditary bleeding disorder affecting two things. It would affect the primary hemostasis and factor VIII. Now let's take a look at three most common things. I think this is like something that you should really know, because these usually come up in exams. What is the most common hereditary hypercoagulable disorder? When you talk about hereditary hypercoagulable disorder, this is going to be factor V Leiden deficiency. But when we talk about the most common inherited bleeding disorder, this would be von Willebrand disease. But usually this isn't super life-threatening because the most common hereditary bleeding disease, I think I need to add bleeding there, that's life-threatening is hemophilia, which we're also going to be talking about later on when we talk about the X-linked recessive diseases. Next, wait, before going to that, one treatment that you can use for von Willebrand disease would be desmopressin. And just to link it quickly to pharma, what are the diseases that can be treated with desmopressin? It's going to be central diabetes insipidus, von Willebrand's disease, nocturnal enuresis, and hemophilia. Which I think, yeah, we're going to be talking about central diabetes insipidus later, as well as hemophilia. Next disease, von Hippel-Lindau. Von Hippel-Lindau, VHL, since there's three letters, it's found in chromosome 3. And thinking with three letters again, what is the disease entity that von Hippel-Lindau is associated with? It causes, VHL causes RCC, or renal cell carcinoma, bilaterally. Next, ALS. ALS is a disease, well, this is amyotrophic lateral sclerosis, which famously afflicted Stephen Hawking when he was still alive. But it's also known as this is, I think, an older name, also known as Lou Gehrig's disease. ALS is a combined UMN and LMN degeneration with no bowel or bladder deficits. Just a quick trivia, I really didn't know who Lou Gehrig was. I just know he was like a baseball player of some sort. So Henry Louis Gehrig was an American professional baseball player who played 17 seasons in the MLB for the New York Yankees. He was renowned for his prowess as a hitter and for his durability, which earned him the nickname of Iron Horse. Occasionally, I would just do a Google search of like random things I learned. It breaks the monotony of just learning purely medicine, because it can get really, really saturating. So like, oh, okay, I'd read something else uh, besides reviewing medicine. So the next disease I talked about was retinoblastoma. So retinoblastoma presents classically as leukocoria in children, and for retinoblastoma, okay, how do you remember what chromosome the gene is found in? Look at the R separated out, like the R is like that separated out. It looks like a 13. So yeah, it's found in chromosome 13. Uh, Another, wait, I forgot. I actually didn't put it here. But another high yield disease that you also find a defect in retinoblastoma in would be osteosarcoma. So osteosarcoma is a defect in your long bones, and characteristically, I think the buzzword there would be a sunburst pattern. The way I remember the sunburst pattern in osteosarcoma is the O looks like a sunburst. Uh, yeah, so that's the way I remember the sunburst pattern in osteosarc. Two-hit hypothesis. For the two-hit hypothesis, usually kasi, di ba, we have uh, two genes, right, from our mother and our father. But if one is already hit, okay, so on the two chromosomes, if you have a sporadic mutation in the other one, you will have a defect in that gene. This works for diseases affecting tumor suppressor genes. Other diseases affecting tumor suppressor genes would include HNPCC and Li-Fraumeni. So Li-Fraumeni, which affects P53, which we'll be talking about later. Like all genes, no, tumor suppressor genes may undergo a variety of mutations. However, most loss of function mutations that occur in TSGs are recessive in nature. So parang how did they explain that? The Knudson hypothesis said that, okay, maybe it's because they already have a pre-existing mutation na recessive, and the another mutation due to environmental factors would cause them to have dysregulated tumor suppressor gene. And what's the most common cause of hereditary colon cancer? This would be Lynch syndrome, also known as HNPCC, or the hereditary non-polyposis colorectal cancer. The governor of the cell cycle, sometimes I don't know why, but this comes out sometimes. Governor of the cell cycle, this is its nickname, is the RB gene. The guardian of the genome, which is defective in Li-Fraumeni, would be P53. Just to correlate quickly to OBGYN and pathology, E6 and E7 in HPV. So E6 divided by 3, you get P53. E7, what comes after 7, it's 8. So RB, the 8 there looks like a B, so it's RB. Just some random mnemonics to help you remember. Next, okay, so this is in my Twitter. So, sabi dito kasi, it looked like this anyone won a battle it out today like men, but then this person, hi Maita, okay, so thought was like, oh men, basa niya as multiple endocrine neoplasia. So like, oh okay, so multiple endocrine neoplasia, what's that? This is a disease, right? Uh, that that is that's autosomal dominant as well, and it consists of these different other diseases because it's a syndrome. Point is, no, we need to know. Sometimes it comes out in boards that you have a different name. So MEN1 is also known as Wermer syndrome. 2A is Sippel syndrome. I have no idea how to memorize that. I just remember Sippel second, so probably 2A. If it looks weird, it's 2B, the Wagenman Frobose 2B. There's really so many eponyms. I wonder why it comes up, but it comes up, so let's just have radical acceptance and accept that it is what it is. So this is from first aid. How to remember the different components of men 1A, men 2A, and men 2B. Men 1A has 3 Ps, so it affects your pituitary, your parathyroid, and your pancreas. Your parathyroid is also affected in men 2A, okay? And this also presents with pheochromocytoma, as you see here. Uh, what's unique about men 2A would be the presence of thyroid in the person of medullary carcinoma. When we talk about men 2B, this is going to be just 1P. This would these patients would have pheochromocytoma. They also have mucosal neuromas, but again, there's only 1P here, so that's a way to remember the different diseases found in your multiple endocrine neoplasias. So again, this is medj pilit, but the two fishes here in this diagram reminded me of this diagram. Tuberous sclerosis. I don't think this is super high yield. I'll just pass through it. Uh, it's a rare multi-system genetic disease that can cause non-cancerous or benign tumors to grow in the brain and other vital organs such as the kidneys, the heart, the eyes, lungs, and skin. The gene affected would be TSC1, which is hamartin, found in chromosome 9, and TSC2, tuberin, easy to remember, 2 tuberin, chromosome 16. A more high yield disorder would be hereditary spherocytosis. So when we talk about hereditary spherocytosis, we think about like, okay, so usually the red blood cells, the RBCs, which measure 7 microns, tama ba? 7 microns are biconcave in shape. Biconcave in shape, however, when you have deficiencies in spectrin or ankyrin, these cells would become spheres-like. So that's why it's hereditary spherocytosis. So the most common cause would be ankyrin deficiency, and because they're big, they can't pass through the cords of Billroth in the spleen. So they're called by the spleen. One way to diagnose this would be through osmotic fragility test. So it's a lot of S, right? Spectrin, spleen, osmotic fragility. And what's the treatment for hereditary spherocytosis? It's a trick question. There's none, but we can alleviate the symptoms by doing splenectomy rather for symptomatic cases. So this is like one of my favorite comics from the Awkward Yeti. So the spleen is very unforgiving with red blood cells, which has a lifespan of 120 days. Just fact check me on that. I'm putting this at the top of my head. Okay, so Huntington disease or Huntington syndrome. This would be a defect in your CAG. So because hunters need cages, and we can use that as a mnemonic to remember that it affects their caudate nucleus, and because of that, it would have a decrease in acetylcholine and your GABA, which is your gamma aminobutyric acid, which is the inhibitory neurotransmitter that's found in your brain. In comparison to your inhibitory neurotransmitter found in your spinal cord, this would be your glycine. What about the excitatory neurotransmitter? This would be glutamate, okay, which is found also in MSG, monosodium glutamate. Marfan. So Marfan is a defect in FBN1, which encodes for fibrillin. And to remember that it's in chromosome 15, we just say fibrillin 15. Marfan fan, the eyes fan out, which means that it's upward and outward. It's like a common buzzword for Marfans. Versus homocystinuria. So in homocystinuria, it's also like a weird eye thing that happens. So you might see that in an exam or in a question stem. The lens point down and in homocystin. So homocystinuria. And it's actually a differential for stroke in the young. Other differentials for stroke in the young would include homocystinuria, methylmalonic, aciduria, and MELAS. MELAS is one of the diseases affecting the mitochondria. So it's actually a mitochondrial inheritance pattern, which means that you can only get it from your mother. So there's one gift that only your mother can give, and that is mitochondrial disease. Because diba, the mitochondria is only found in the egg cell, and you can think about the sperm as just like a donor of genetic material. Sorry, dads, and us in the future when we become fathers. we're only genetic material donors. The mitochondria is, the mitochondrial diseases can only be passed down from the maternal side. So MELAS is mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. Okay, so way to remember this is if you have a stroke in the young, that doesn't usually happen, diba? Strokes usually affect older people. But if you have a person presenting with stroke na medyo bata pa, like our age, you go, what are my differentials for stroke in the young? That's homocystinuria, methylmalonic aciduria, and MELAS. And this one, actually posted this question on Facebook. Uh, like for example, this patient presents with severe pain. You perform a physical exam and he scores a 9 in the Baton score. Basically, this patient is very hypermobile. Genetic analysis reveals a COL5A1 mutation in chromosome 9, which is the mode of inheritance exemplified by the disease. If you watched my video earlier, you would know that this is autosomal dominant, right? This is a disease entity most likely the disease entity with COL5A1 mutation would be Ehlers-Danlos, type 1 or type 2, because that's the one presenting with COL5A1 or COL5A2 disease. But the most common type is the hypermobility type 3. Okay, but that one has a different mutation. Take note that, again, as I mentioned in the previous video, Ehlers-Danlos is usually autosomal dominant, except for one type, which is type 6, which is autosomal recessive. In this type, there is a deficiency in lysyl oxidase, wherein affected patients will present with kyphoscoliosis. This is from a table that you can see in Robbins' 10th edition, table 5.5. Lysyl oxidase, we're also going to be talking about this when we talk about Menkes disease with kinky hair. What is the most serious type of Ehlers-Danlos? The most serious type of Ehlers-Danlos is going to be the vascular type, or the type 4. Why is that the case? Because these patients can present with aortic dissection. And recall that aortic dissection, as a link to internal medicine, well, these patients would classically in a question stem present as patients with pain described as a tearing sensation in the back. I just thought about it, but yeah, type 4 looks like an A, so you can remember A, aortic dissection. Conn syndrome. Conn syndrome, this is going to be seen in patients with bilateral adrenal hyperplasia leading to an increase in aldosterone. So they're going to present with hyperaldosteronism. And they would have decrease in renin. And this leads to treatment-resistant hypertension. So if you have a patient that's treatment-resistant, consider, hey, maybe this guy has Conn syndrome. Familial hypercholesterolemia. So familial hypercholesterolemia, I associate it right away with an LDL defect. So an LDL, low density lipoprotein, because this is a mutation found in 85% of the cases. And a classic buzzword that you would see there would be a corneal arcus, the grayish ring around your eyes, which would actually be not that pathologic. If you see it in an older patient, well, this would present as your arcus senilis. But if you see it in a younger patient, you'd be like, does this guy have familial hypercholesterolemia? Next syndrome, Osler-Weber-Rendu. Osler-Weber-Rendu is hereditary hemorrhagic telangiectasia. Kind of rare, I think. And I want to harp in on a different disease, which is different but similar sounding. This would be hereditary angioedema. Hereditary angioedema, otherwise known as C1 esterase deficiency, is defined by recurrent episodes of angioedema without urticaria or pruritus. Let's link this to another pathology, which would be, what if you have a deficiency in your late complement, that is your C5 to C9. In C5 to C9, you won't be able to form the membrane attack complex that attacks bacteria. So, the membrane attack complex attacks bacteria, and particularly, they attack cells with, I think with capsules. I have to get back into that. But the point is, you're prone to infection when you have C5 to C9 deficiency. Okay. trying to recall at the top of my head if it's encapsulated organisms or those producing catalase. Kasi you also have chronic granulomatous disease affecting catalase positive organisms. But again, regardless, if you have patients with splenectomy, as we talked about earlier, if you have a patient that undergoes splenectomy, then you should consider vaccinating them before the splenectomy with anti-pneumococcal because those are encapsulated organisms. Okay? So hereditary spherocytosis, splenectomy. Okay, so next we have, Li-Fraumeni. We alluded to this earlier. Li-Fraumeni has loss of P53, which is a tumor suppressor gene found in chromosome 17. I still don't know how you would remember that, but it's found in chromosome 17. And typically, this is, I think, found in most cancers. But you can also remember that it's found in SBLA, which is sarcoma, breast cancer, leukemia, adrenal gland tumors. Okay. So, this one, I think this is going to, neurofibromatosis. So, neurofibromatosis, historically known as von Recklinghausen's disease. I have no idea if they're going to bring that out, but if they do bring it out, you know that von Recklinghausen disease is NF1. It's a genetic disorder characterized by an increased risk for developing benign and cancerous, non-cancerous tumors. And this would be the manifestations. You would have a buzzword of coffee olay spots, Lish nodules. This is common. I think yun yung pinaka buzzwords for type 1. Here you would have a patient. I think this is from Papa Him in Twitter. He posted this picture where you have so he just posted this picture, but there wouldn't be any pictures in the PLE in the boards for the Philippines. So this would be bilateral acoustic schwannoma. So if you see a bilateral acoustic schwannoma, think of NF2. And NF2 is easy to remember because they're all 2s, right? The mutated tumor suppressor gene in NF2 is, NF2. It's found in chromosome 22 in the Q arm 12.2. A lot of 2s. And they present with bilateral acoustic schwannomas. Familial adenomatous polyposis. This presents with like thousands of polyps on colonoscopy. This is an autosomal dominant mutation of the APC tumor suppressor gene on chromosome 5q, 21q22. Do I have a mnemonic for that? I don't think so. Yeah, not everything will have mnemonics, unfortunately. I'm trying to recall at the top of my head, like if I've... FAP5. Okay, FAP5. Oh, okay, super random. FAP5, chromosome 5. Okay, so thousands of polyps arise starting after puberty. It's pancolonic and always involves the rectum. Prophylactic colectomy or else it 100% of the time leads to colorectal cancer. So that's it for the autosomal dominant disease. In the next video, I'm going to talk about the X-linked recessive diseases. I'll cut it here because it's already almost 30 minutes. I'll post another video.